Amigos, feliz viernes. Hoy es viernes. Yo soy Rory y estoy contento de estar aquí contigo. I've got a full lesson for you today. Los síntomas en español. Now, one of the things that really helps your listening comprehension and your ability to piece together ideas is to work on your vocabulary. And we are going to work on some symptom vocabulary today. If there's anything that helps you understand what's going on with your patient, it's knowing symptom vocabulario. So let's dive right in. Before we get too deep in vocabulario, let's review a couple of verbos importantes. Dos verbos importantes. We've got el verbo tener, which is the verb to have. Yo tengo, tú tienes, él, ella, usted tiene. So I have, you have, the to form like for kids. Él, ella, he, she, usted, you form for adults, tiene. Nosotros tenemos, we have. Ellos, ellas, ustedes tienen. They have, okay? You've got some underlined syllables here, underlined letters here. That's because we call this a stem changer, otherwise known as a boot verb. So when you've got a verb that looks like this, that means there's a change in the stem, in the present tense, it's going to conjugate in like this boot format. So the yo form here doesn't give us a good example because this is an irregular verb and the yo form's irregular, but normally the yo form would change. The to form does, el, ella, usted form does, and then the ellos, ellas, ustedes form does. The nosotros doesn't because it's not in the boot. Let's look at our second verb and we'll see that it does have that change in the yo form also. So sentirse, this is the verb to feel. Sentir could be reflexive with the se on the end, or not reflexive, and we'll look at the difference here in a minute. So, yo siento, or yo me siento, I feel. Tú te sientes, or tú sientes, you feel. Él y usted se siente, or siente, you feel, he feels, she feels. Nosotros sentimos, or nos sentimos, we feel. And then ellos, ellas, ustedes se sienten or sienten, they feel, or y'all feel. Again, this is a stem changer. We see that all of the conjugations within the boot have that stem change, right? Okay, but not in nosotros because there's no stem change in nosotros. So we talked about sentir y sentirse, could be reflexive, could be not. How would you know what's the difference? So sentir versus sentirse, when it's reflexive or not reflexive. Let's look at some examples. ¿Cómo se siente hoy? How are you feeling today? Me siento mejor. Ya no tengo vómitos ni diarrea. I feel better. I don't have any more vomiting or diarrhea. ¿Todavía siente dolor en el abdomen? Sí, todavía me duele el estómago. So do you still feel pain in your abdomen? Yeah, I still, my stomach still hurts, basically. ¿Tiene fiebre? Creo que sí, porque siento calor y luego tengo escalofríos. Be looking for patterns. This top one was reflexive. So far, these two are not. What's the difference? Let's keep looking. ¿Se siente fatigado o ha vuelto la energía? Are you feeling fatigued or has your energy come back? Sí, todavía me siento cansado y tengo ganas de descansar. Are you seeing any patterns here? Let me share with you the difference. When it's reflexivo, notice that you've got an adjective after it. How are you feeling today? I'm feeling better, worse, etc., fatigued, tired. When it's reflexive, you got an adjective. We're talking about yourself, how you feel in yourself. But these others aren't using an adjective. They're using a noun. ¿Todavía siente dolor? Are you feeling an object? Are you feeling pain? Or siento calor. I feel heat. Okay, so that's the difference. When you've got an adjective, it's probably describing a feeling or an emotion within yourself. And so it's reflexivo. When it's not reflexive, you've got a noun there, and that noun is an object. You feel that other object. Okay, all right. Preguntas útiles. When we talk in síntomas, here are some common questions to help you understand what some patient symptoms are. ¿Cómo se siente hoy? We've seen that one. How do you feel today? ¿Qué síntomas tiene? What symptoms do you have? ¿Qué otros síntomas tiene? What other symptoms do you have? Tiene or siente dolor, calor, escalofríos, whatever it might be. Fill in the blank with a symptom there. Do you have or do you feel this particular symptom? Se siente. Now this is going to have an adjective. Do you feel tired, hungry, whatever it might be? ¿Por cuánto tiempo ha tenido? For how long have you had? ¿Cuándo empezó? When did this start? ¿Cuándo empezó la náusea, el vómito, el dolor, etc.? When did it start? ¿Cuándo tiene or cuándo siente? When do you have nausea, vomiting, etc.? ¿Cuándo está mejor o peor? When is it better? When is it worse? Okay. Now let's look at some frases to give us an idea of some descriptions of when this stuff happens. All right. So we've got frases antes de, before, después de, after, de repente, suddenly, a veces, sometimes, siempre, always, nunca, never, poco, a lot, mucho, poco, little, mucho, a lot, and me duele, it hurts me, so we're going to put an object there, me duele la cabeza, me duele el oído, me duele el ojo, etc. Me pica, this kind of stings. So me pica el ojo, me pica la piel, my skin kind of itches, yeah? Me arde, it burns. Me arde el pecho, me arde el estómago, me arde la garganta, something, I have this burning sensation. Me cuesta, me cuesta. Literally means it costs me, but figuratively, and the best interpretation for us in English is, this is hard for me, es difícil. Me cuesta respirar. Me cuesta caminar, or subir las escaleras, to go up the stairs. It's hard for me to go up the stairs, etc. Okay, so we've got some preguntas and some frases to help us understand when people are talking about symptoms. Let's dive in to look at vocabulario sobre los síntomas. We've got them organized by area here. So en la cabeza, we've got congestión, congestion, estornudo, sneezing, goteo nasal, so dripping, like a runny nose, or goteo postnasal, like a postnasal drip, mareo, dizziness, mareo, nariz tapada, or nariz tapada, so a stuffy nose, en el pecho, falta de aire, shortness of breath, flema verdosa, like greenish phlegm, palpitaciones, so palpitations, silbido, wheezing, tos, cough, tos seca, dry cough, tos productiva, a productive cough. And now let's look at el cuerpo. Fatigue, fiebre, fever, náusea, nausea, vómito, vomiting, con sangre. You could have anything con sangre, vómito con sangre, diarrea con sangre, etc. Oh yeah, diarrea, there we go, con sangre. Estreñimiento, the opposite of diarrhea, so constipation. Estreñimiento. Gas abdominal. Most of the time you just talk about tengo gas, so then it's usually, people understand it as just gassy, but gas abdominal. Okay. Cólicos is like feminine cramping or colic in children. And then la piel, the skin. Irritación, erupción, 2 words for rash. Salpullido and ronchas, 2 words for hives. Sorry, there's so much repetition here. Moretones, magulladuras, also 2 words for bruising or bruises. Picazón and comezón, so also 2 words for itching. And enrojecimiento, redness, and rojes, redness. All right, muy bien. Sorry that skin has so many really common synonyms. I guess working dermatology isn't that easy after all. Okay, all right, muy bien. Unos signos y síntomas más. No offense to any dermatólogos out there. Okay, unos signos y síntomas más. Acidía, ácidos, agruras, y reflujo. All of these mean heartburn. Okay, if you thought 2 was bad in the derm sense, now we got 4. Ansiedad and nervios, so anxiety, nerves. Boca seca, ojos secos, piel seca. Remember what tos seca was? That was a dry cough. So what are these things? Dry mouth, boca seca, ojos secos, dry eyes, piel seca, dry skin. Okay. Cambios en, so changes in. Cambios en color, so changes in color. Cambios en visión. Cambios en whatever it might be. Apetito maybe. Cambios en sueño, in your sleep. Cambios en peso, in your weight, etc. So you just fill in the blank there. Cambios en. Convulsiones, seizures. Desecho or flujo, any kind of discharge or fluid. Dificultad para, so difficulty doing something. Dificultad para respirar, difficulty breathing. Dificultad para orinar, difficulty urinating. Dificultad para tragar, difficulty swallowing. Dificultad para dormir, difficulty sleeping. And then dolor de, we can put any part of the body there and have good communication. Dolor de cabeza, dolor de estómago, etc. So headache, stomachache. Dolor al. So now it's not dolor de anymore. Dolor de, a part. Dolor al, a verb. So dolor al, pain with. Dolor al is like upon orinar. So pain with urination. Pain with moving. Dolor al toser, pain with coughing. Hinchazón, swelling. Hormigueo, tingling. Inflamación, inflammation. Inquietud is like this unsettledness or restlessness. Lesión, any kind of injury or wound. Malestar general, like general malaise. Modorra, drowsiness. Pérdida de, loss of. Pérdida de apetito, loss of appetite. Pérdida de audición, loss of hearing. Pérdida de conocimiento, loss of consciousness. Pérdida de sensación, so loss of feeling, sensation. Resfrío, resfriado, two good words for cold, like chest cold or head cold. Sangre de or sangrado de, so like any way to talk about the noun, like bleeding from, okay? Sudores, sweating. Sueño, sleepiness or tiredness or sleep itself. Temblores, like shakiness, okay? All right, so we've got a lot of síntomas aquí between the last slide and this one. And down below, well, further on in the presentation, you're going to see that we've got some Quizlet vocabulary for you to work through. And down below this video, you've got Quizlet vocabulary to work on as well. So I really encourage you to work on this little by little. Print them out so you have them, write them down if that helps, but study this vocabulario. Let's look at some descripciones del dolor. So we've got tipos de dolor, like dolor sordo, a dull pain, dolor agudo, a sharp pain, dolor constante, a constant pain, dolor que va y viene, so pain that comes and goes. And sorry, these are not in alphabetical order, they're kind of juxtaposed with each other. Dolor ardiente or quemante, like a burning pain. Dolor con presión, pain with pressure. Dolor pulsante, like a throbbing pain. Dolor irradiado, a radiating pain. Dolor que corre por, so like a shooting pain. Dolor que corre por, shoots through. Dolor que corre a, shoots to. So you'd add a body part on the end of either of those, but por means through, a means to. Okay? Dolor punzante, a stabbing pain. And then we talk about intensidades. So we've got the types, characteristics, and now intensidades. Dolor leve, like a light pain. Dolor moderado, moderate pain. Dolor fuerte, a strong or heavy pain. Dolor severo, severe pain. And el peor dolor, like the worst pain ever. So we've done another video Viernes lesson on pain, and here is the link to head over to see it, and it is linked up down below in the blog post as well. So if you're just on the YouTube viewing this, make sure you head over to the website and you can follow the links to see the lesson specifically about pain in Spanish. All right, so we did tener and sentir, say, but let's take a look at dos otros verbos importantes when we talk about síntomas. The first one is estar, the verb to be. So yo estoy, I am, tú estás, you are, él, ella, usted está, nosotros estamos, ellos, ellas, ustedes están. The verb to be. I am, you are, he, she, you, usted is, we are, ellos, ellas, ustedes, they or y'all are. Okay? And then el otro verbo, and we've seen some examples, is the verb dolerle. Dolerle. This is the verb to hurt. Dolor means pain, but doler is the verb to hurt. Okay? Entonces, we've got, this one sort of works a little differently than other verbs. This one is me duele or me duelen, and then you add the body part there. Me duele la cabeza, me duele el ojo, me duelen los ojos. So both of them. Okay? So if the body part's plural, it's duelen. If it's singular, it's duele. Okay? So me duele, it hurts me. Te duele, it hurts you. Le duele, it hurts you, usted, or him or her. Nos duele, it hurts us. Les duele, it hurts them, or it hurts y'all, like ustedes. Okay? Let's look at some examples. Mi rodilla izquierda está muy hinchada. My left knee is very swollen. Me duele mucho. It hurts me a lot cuando yo camino, when I walk. Está mejor, it's better, cuando descanso, when I rest, y elevo la pierna, and I elevate the leg. Me duelen los oídos. Están inflamados y muy sensibles. So my ears hurt. They're inflamed and they're really sensitive. Me duele usar un palito de algodón. It hurts to use a Q-tip, un palito de algodón. Okay, let's look at some patterns we see here. Okay. Mi rodilla izquierda está muy hinchada. Is swollen, is very swollen. Me duele mucho. It hurts a lot cuando yo camino, when I walk. Me duele, singular. We're not talking about multiple body parts. We're actually talking about it hurts when I do something, right? So there's a verb coming and we just say me duele. That's your most common, me duele. Está mejor, it's better, cuando descanso y elevo la pierna. It's better when I rest and elevate the leg. Now we've got two ears, right? Me duelen los oídos. Both of my ears hurt. Están inflamados. They are inflamed. Y muy sensibles, insensitive. Me duele usar un palito de algodón. Here we go. Me duele singular again with a verb. Usar un palito de algodón. So if we're talking about body parts, then you're going to either do singular or plural depending on if you're talking about more than one body part or not. But if you're talking about an action that hurts, it's just singular, me duele. Okay? All right. There's a lot of vocabulary that goes with the verb estar to talk about some signs and symptoms. Let's take a look. Vocabulario con estar. We've got dislocado, dislocated, o dislocada. So, por ejemplo, el hombro, masculine, el hombro, está dislocado. Okay? La rodilla, feminine, la rodilla. You can't see because I can't get my leg up that high. La rodilla está dislocada. So the knee is dislocated. Or la cadera, the hip, está dislocada. Okay? Fracturado, same difference if you're describing a masculine body part. Fracturado, feminine, fracturada. Okay. Fracturado, fracturada, fractured. Fuerte, strong. Hinchado, swollen, hinchada. Infectado, infectada, infected. Inflamado, inflamada, inflamed. Lacerado, lacerada, lacerated. Lesionado, lesionada, injured. Leve, light. Now, there's a pretty big difference between fuerte, leve, and the rest of these, right? The rest of these are just simple adjectives to describe the injury on a particular body part. But fuerte, leve, these are descriptors of pain, yeah? Fuerte, like really strong or high pain, or duele mucho, right? And then leve, a light pain. Magullado, bruised. Mejor, better, okay? Peor, worse. Quebrado, broken. Quemado, burned. Roto, also broken or torn. This one's good for soft tissue. Quebrado's not really good, broken for soft tissue, but roto is good for soft tissue. Muscles, ligaments, etc. Severo, severe. Torcido, twisted or sprained. Okay, bien, so we've got these simple adjectives aquí are for good descriptions of pain, etc. But the others son buenas, and they will change depending on what the body part is, if it's el or la, right? Okay, unas frases de transición. After we've understood what someone's síntomas are, frases de transición. Necesito, I need to. Necesito examinarle, I need to examine you. Necesito mirarle, I need to look at, and then you add the body part there. Los ojos, la garganta, la boca, los oídos, etc. Escucharle, listen to. Escucharle el corazón. Escucharle los pulmones, your lungs, your heart. Favor de, please. Favor de acostarse, please lie down. Favor de respirar profundo, please breathe deeply. Respirar profundo. And then respirar normal, breathe regular. Favor de esperar aquí, maybe. Wait here, please wait here. Okay? Favor de quitarse, please take off something. La camisa, la chaqueta, whatever it might be. So you can add an article of clothing there. Favor de quitarse. Usted necesita, you need to. Usted necesita tomar, you need to take whatever it might be. Usted necesita descansar, you need to rest. Necesita usar, whatever it is that you want them to use. And then voy a, I'm going to. Voy a hablar con, I'm going to speak with, fill in the blank with whoever you need to speak with. Voy a hacerle. I'm going to do on you maybe un examen físico or un examen pélvico or un examen neurológico or whatever it might be. Okay? So I'm going to do, and that le just means onto you as my patient. Pedir, I'm going to order or ask for. Recetarle, prescribe to you. Voy a recetarle un antibiótico, un analgésico, un antihistamínico, whatever it might be. Okay? All right, so we've got unas frases de transición after we've understood what the patient's symptoms are. I mentioned early on that there's a lot of vocabulario, and that's your best first step for really working on your comprehension and being able to communicate some basic ideas. And so find the common symptoms vocabulary in Spanish on Quizlet and do the activities. Here's our Quizlet handle there. Quizlet.com/CGI Spanish. You can see all of our Quizlet vocabulary sets. There are, I think, more than 100 or so vocabulary sets there, and most of them have to do with medical Spanish. So get in there and take a look. Okay, it's time to practicar. Converse con su paciente sobre sus síntomas. Okay, so you're going to, with your partner, your partner is your patient, and talk with them about their symptoms. So primero, Julia tiene una infección de las vías respiratorias. Julia's got an airway infection or like upper respiratory infection. Okay. Juan tiene dolor de espalda. Juan's got back pain. Pablito tiene dolor de oído. Pablito's got some ear pain. Verónica está fatigada. Verónica is fatigued and y no tiene ganas de hacer nada, and she doesn't have any interest in doing anything. Cecilia tiene dolor en los huesos y las articulaciones. So Cecilia has pain in her bones and joints. Okay? Y María tiene dolor de abdomen frecuente. María has frequent abdominal pain. Okay, so with your conversation partner, play the role of these people, and you can take these scenarios in multiple different directions. You can make them easy, you can make them hard, but give yourself an opportunity to do some practice, okay? Preguntas, make sure you post your questions below this video. And by the way, if you're learning something new, if you learned something new in this video, make sure you like the video, subscribe to our YouTube channel so that others will see it and that you'll get regular updates as well as we post new videos. If you need a conversation partner, head over to the Learning Medical Spanish Facebook group. Put yourself out there. Hey, I'm Rory. I'm a beginner. I'm looking for practice. Who wants to be my conversation partner? You know, that kind of thing. Okay, amigos, gracias por aprender español conmigo. Thanks for learning Spanish with me. Juntos mejoramos comunidades. Together we really are improving communities by improving communication. Para más español, head over to the website, commongroundinternational.com. And if you would like to take a free medical Spanish terminology test, head over to Certified Spanish, and you can create a free account and take as many medical Spanish terminology tests as you want, completely free. Gracias, amigos. Be sure to like our video, subscribe to our channel, y nos vemos la próxima semana. Chao.